and welcome to this episode.
I to count 10 now?
Just go ahead.
Go ahead. I can start talking? Well, then I better start saying by welcome to ICRC-TV's COVID HR and business updates. Another episode. I know, we have too much fun on this, but you know, that's the whole idea, right? You're getting so much information. You're watching all these crazy PowerPoint webinars about businesses and all the things that they're doing that are more than likely not at all applicable to what you need to know. So we decided to lower it a little bit down to what's actually going on in your particular situations, what can you instantly apply, and what's going to bring you the greatest amount of success as we go through this new event called COVID-19. My name is Pandy Pridemore. I'm the principal consultant for the Human Resource USA. And I've got a wonderful set of speakers and presenters for you today. We've got, as you can see, I'm not in my regular office. I am actually on site at the Office Furniture Solutions, or Office Source, excuse me, Office Furniture Source here in the Westchester market. And we're going to be talking with Peter Ellington, president of the company, who's going to be walking us through ideas and quick fixes for all of you as you go into your workplaces and you start, you know, yes, we know we have to sanitize. Yes, we have to keep everything clean. But what are we doing with our space? I mean, have you guys really thought about that? When I go into some of my clients, I realize there is no, you can't stretch the walls out without knocking things down. You can't dig a hole and make the room bigger. And sometimes our budgets are so tight, we have to work with what we've got. Well, Peter's going to actually help us with some of that. He's going to walk us through, show us not only tricks that we can do with what we have, but also some of the new innovations and some of the new things that might be added on a very reasonable budget. So we're looking forward to that. But you know, from the HR perspective, I got to have somebody coming in and talking about some of that. So today we have Jamie Charlton from Saxon, who is my strategic business partner when it comes to employee benefits. Jamie's the guy I always go to, and his team is spectacular. But we haven't talked about that on the show. What's going on with employee benefits? And do you guys all understand all the different rules that haven't changed and all the paperwork and documents that have to be maintained to make sure that we're compliant from that perspective? Because as we all know, change is the only constant in the universe, and it's going at the speed of light. So James is going to join us here in just a few minutes to talk about that, but let's do some house cleaning. Last week, we went over the CDC's new changes on symptoms. If you don't have a copy of that, please make sure that you either get it off the website or you check with your consultant or your labor law attorney, get those new symptoms, because again, the FFCRA programs are going to be applied to things like headaches and chills and body aches, and we haven't had to worry about that. We've been so focused on fevers and coughing that now these other symptoms may be indications that an individual needs to be tested, so get that list. We also stressed that the EEOC has changed the guidelines on how we can converse with our employees in regards to health questions. And remember, that's all COVID related. None of the old rules have changed. So if you're not well trained on EEOC, again, get with your labor law attorney or get your consultant, and we'll be more than happy to walk you through all of that, because easy mistakes can be made in that area, and just familiarize yourself with that. And then OSHA, we absolutely put a lot of emphasis on the last show in regards to OSHA. And if you have not sat down with your people and walked through, I know, it's basic common sense stuff. But I'm telling you right now, if you don't show that you have walked this stuff through with your employees, and you can't show that you've had these conversations with them, something may very well happen. And we're now starting to see in the crowds that I run with, the attorneys are starting to talk about, we're going to have claims. We're going to have people getting upset and accusing employers of such things. And remember, the OSHA guidelines are, if you show that you're not being negligent, if you're showing that you're putting effort into this training and you're practicing social distancing and you're enforcing the masks and you're doing the things that CDC and OSHA want you to do, there will be no tort claims, but you can't demonstrate negligence. So again, big things that came out of last week's meetings or our last show. So I'm really hoping that you can glean just as important stuff from today's, and send your questions in if you have them, of course. Otherwise, let us know afterwards, because everything that you think and feel and experience is important to us. So enough for me. Let's go. Jamie Charlton, welcome to the show.
Thanks, Manny. It's good to see you. Sorry I had you on mute. I've got 5 kids and 2 dogs at home, so I wanted to make sure we didn't interrupt you.
Hey, I love them all, so it makes no difference. Bring them on, especially if they know what's going on with this stuff.
Yeah. Does anybody?
We have not talked about employee benefits at all on the show. And when I started thinking about this a little bit the other day, I thought, my gosh, with everybody losing their jobs, we've got all these qualifying events of individuals now either having to go on COBRA or coming on to their spouse's coverage. Tell me what it really looks like out there.
Well, when this first hit, that was a scary thing about it. A lot of employer groups that we work with called and asked what they could do. Thank goodness the government has acted pretty quickly. A big saving grace was the carriers working with the government. I mean, you've got 2 big bureaucracies working together, which was very nice. A lot of them extended premium payments. So some of these groups were able to delay paying the premium for 60 days. Now, some carriers have even moved that out now to July 31st.
Oh, I did not know that.
Yeah, there's a few carriers that have gone to July 31. Most of them are still at May 31, but a few did come in at July 31. So make sure you ask if you're not with Saxon, make sure you ask the broker you're working with, what your particular carrier is doing, if you need to go down that path. And we had a few, not very many, of our groups that chose that route. One caveat to that route that I do want to inform some folks, caught some of our groups by surprise, is the carrier will not pay claims during that time. So you're still insured, but it's kind of like I equate it to using layaway at a store. Those of us that are old enough to remember when our mom and dad used layaway, that's what it is. So the carrier is reserving your insurance for you. And as long as you pay that bill, at some point in the future, your claims will get paid. However, some of our groups are going in and finding out claims weren't getting paid when they saw a doctor. So if you do take that route of deferring your premium, make sure you pay that bill. Once you pay your bill, Pandy, then all claims will be brought up to current standard. But
Jamie, oh my gosh. So are you advising your clients to talk to your employees or talk to their employees about that so that they don't expect it being declined or denied?
Yes, exactly right. Because that's what happened. We had an employer who did go on furlough with this premium payment, and an employee went to the doctor and they said your claim's not being paid, and so they blew a gasket, rightfully so, thinking that they had gone without coverage. Their employer had canceled coverage. Right. When in fact the employer had not done that. He simply just decided he wasn't going to pay the bill that month and used a furlough. And in talking to the carriers, basically what's going to happen is once those premiums come current, all claims will be released and paid. But again, like using layaway, if you go to I remember my mom used to go to JCPenney or Sears and use layaway. You never got the goods until you paid the bill. Well, the same thing is here. So if you have an employer that doesn't pay their premium, those claims will become that employee's responsibility. So if any employers out there are thinking about doing that or have done that, just know that until your premiums come current with that carrier, those claims are not going to be honored.
Well, and that's going to be a crucial conversation for the employers, because if they're taking those premiums out of the employees' paychecks, let's say that they're essential workers, the employees are paying the premiums, but the employer's not paying the bill, then they definitely need to have that conversation so that the employee understands that it's just a postponement.
Correct.
But, and that they can't, oh my gosh, I'm going down. Can the doctors go against the employee's credit for not having a bill paid after 2 or 3 months?
I don't believe so, Pandy, because technically if the doctor called the insurance company and asked if that person was covered, they would be covered. Okay. I mean, in the insurance systems, they are going to be covered. Okay. They're just not going to now. if that employer decides not to pay their claims or pay their premium, then yeah, I mean, technically that is the responsibility of the employee to then come, to clear up that bill with the doctor. So that's a different situation. And then knock on wood, we haven't had that situation come up yet.
Yeah.
But our advice to employers is if you have the money, go ahead and pay your premium. Don't for a lot of employers are doing it because they think it's a way of delaying that bill for a few months and they can preserve cash flow. Our advice to them is if you have the cash, go ahead and pay that. And you have no interest in getting rid of healthcare, you go ahead and pay that bill now, because eventually you're going to have to pay it up. So you're either going to pay the $5,000 monthly bill now, or you're going to pay $10,000 or $15,000 2 or 3 months down to bring it up, because it's going to be one lump sum payment. It's not.
That was going to be my next question.
Yes.
Okay.
So and that goes into also, I'm not sure if I'm jumping the boat here on you, but that also goes into the COBRA extension. I think you alluded to just a minute ago for individuals. So Congress has come out and they've extended the COBRA rights down until this thing is declared over. Once this thing is declared over, that's the new set date for COBRA. So then I have 60 days after the declared over date to get my COBRA going. So in theory, if I go on COBRA today, I could have COBRA without paying any premium until September or October or November of this year, and not pay a premium until then. However, the same thing happens.
Yeah.
If you want to go back and have claims that you put off in May, or you had covered in May or July but never paid that premium, that individual's got to come all the way back and pay all those premiums to honor their COBRA. So let's say I have COBRA and I go in November when this thing's finally over, perhaps, and my service was done in July, and I haven't had the hospital. I haven't been in the hospital since July. Well, what I'll do to make sure I get that claim paid is pay my bill from, let's say I went out March 30th. So make sure I pay April, May, June, July's premium. And then I don't have to pay the rest of the premium in theory because I didn't have coverage or didn't have the need for care.
Yeah.
But you're going to have to go all the way back and come all the way forward if you take that COBRA option as well, because they have relaxed the COBRA premium payments as well.
I did not know that. Thank you. And would that be the same for the state continuation?
Mm-hmm.
For employers with less than 20?
Right.
There's state continuation here in the state of Ohio, so that kind of allows everybody to have some kind of a coverage. You know, back in 2009, 2010, and you and I were working together back then, they had COBRA extended as well as unemployment. Do you think that'll happen again with this situation, going beyond the 12 months?
Well, COBRA's 18. I think right now, I haven't heard that yet. So I don't think so. Now, if my COBRA start date is there, then yeah, I mean, it's very possible they could say, okay, you know what, you had this much COBRA time, your real COBRA is going to start here. Now you have 18 months going forward. Yeah. It very possibly could be. Now, my hope is that, you know, as we return to work, a lot of these people that are facing this are being brought back into the workplace. Mm-hmm. I know we can't hire 13 million people overnight, but my hope is some of these folks will find work pretty quickly and won't be in that COBRA experience, because what we're finding too is a lot of folks just can't afford COBRA.
Oh gosh, absolutely.
And so, you know,
it's actually a nice thing though, because then they suddenly realize how much their employer actually contributed to the premium and what an extra benefit that was. Because I don't think any employers just don't go out and tell their employee, okay, your actual premium is 1,000, but you're only paying 200. I wish they did. I wish they understood and the importance of that. All right, well, let's kind of caveat off of that a little bit, Jamie. Let's talk to them about, our viewers, about the paperwork necessary. Let's say that somebody does, we've laid them off and we're bringing them back. All the paperwork has to be filled out because they were terminated and they were taken completely off the plan?
Yeah, if they've been terminated. Now, if they're furloughed, obviously they're still on the plan, so that's no problem. That's more of a payroll function than a benefit function. Okay. But yes, if they've been terminated off that plan, and that's another piece of advice we've been giving to our clients, is if you haven't any interest at all in bringing these folks back anytime soon, save yourself the hassle of terminating them. Because again, Pam, to your point, you got to bring them back on, and then in the insurance company's eyes, are they coming on as a new hire? Are they coming on as return to work? Do they have to resatisfy if you have a waiting period before your benefits? Do they have to resatisfy a waiting period to get back on? Or they can come on day one and just pick up benefits going forward. So yeah, it's a whole different measuring game of when was that person terminated? How long have they been released? If they come back on, will that carrier make an exception to bring them back on from date of termination? or do they have to come back in on a waiting period, which could be a lot. I mean, if you got 90-day waiting period, that could hurt a lot of people.
Well, and you just said the carrier, so it's truly up to the carrier. So Aetna and UHC and Humana, they get to decide those rules.
Yeah.
Oh, so even if it's not in the plan description, the carrier can implement that.
Well, no, I mean, that would be in the plan description. So it's just a matter of time of how long that person's been gone.
Okay.
Before they implement that. But I'll be honest, most of the carriers have been very accommodating. They understand that these employers are going through a lot, and so are the employees. So a lot of them have been accommodating. I think you'll see that quite a bit moving forward for the time being.
Yeah.
I just got off the phone today with the particular carrier who's giving premium relief on their dental plans because all the dentists have been closed for the last several months and nobody's using their dental plan. So you'll have employers, with this particular carrier, it's copycat industry. So you'll probably see it with some other carriers because folks aren't going to the dentist, they're giving 10% credit back on the dental premium.
Oh, that's so nice.
So the carriers have been great. I mean, I think they understand where a lot of people are. And to be honest, it's in the carrier's best interest to keep people on their plans.
Sure.
So I think they're gonna be accommodative to the needs. A big thing that's helped a lot is the PPP program. I know a lot of our clients have qualified for that, which, not only for payroll, but they can use that for benefits. So that's been a good help to have people stay on benefits as well. So the PPP has really helped people, especially since there's been 2 waves of it. Yeah. I know they're currently debating a 3rd wave in Congress. But the folks that have gotten the PPP, that that's helped quite a bit.
Okay, so I'm gonna back you up here a little bit. Help me understand how long somebody can be furloughed in the eyes of the carriers before those benefits have to go away. Because if you look at the definition, and we never really use the word furlough in HR, it's always you've either laid the person off or you've terminated them for cause. But now everybody's using this term furlough, and we've got these extra little benefits around furlough. But can somebody stay furloughed through December and still be on the company plan? Isn't there a deadline or a cutoff there somewhere?
Yeah, so the big one, when this first came out, the big one was May 31st. And there's still several carriers that are at May 31st. And I thought, I think the thinking is they thought this would probably be resolved by then or getting close to being resolved. And, as you know, here in Ohio, we've started phase 1. And so we'll see where that goes. There are two of the national carriers, though, have extended furloughness to, that's even a word, to July 31st. So you do see some of these folks that, that have a national footprint that have pushed back the furlough rules to July 31.
Oh, that's really nice.
Yes.
That's because, again, we've got employers that want to open up their doors, but not all their operations are available. I mean, we just they don't have the need for their entire staff. The intent's there, but no one was really talking about, well, how long can somebody actually stay furloughed before they're officially laid off?
Well, that doesn't concern me as much as what these employers are paying a benefit. Because again, remember, even if they're furloughed, they're not working, but that premium doesn't stop.
Exactly.
So somebody's got to pay that premium for that employee that's not generating any revenue for that business. So my bigger fear, I think it's awesome the carriers are pushing that date back and back, but it's how long can that business sustain keeping people on premium? And if some people aren't working, does that mean the employer pays 100% of the premium because the employee doesn't have any income to put towards it? Are employer groups saying, hey, you know what, Pandy, we'll furlough you for 3 months, but when you come back, we're going to add 50% of your premium back in over time to catch you up. So that's also the equation that we're working with employers that are doing furlough is how do they recoup that premium?
Oh, exactly. Because I don't know of any employees that are furloughed that are actually paying their portion of the premium.
Right.
I mean, it's not.
Yeah.
And that's a chunk of change.
Yes. So it's a great maneuver by the carriers. It's just how does that employer afford it? A, now, and then B, if they do decide to recoup, how do they recoup? And is that affordable to the employee?
Has there been any talk at all in the industry about where the impact of COVID and all the medical expenses that are being incurred, especially in those hot spots? Has there been any talk in the industry about where they see the price of healthcare going?
It's funny you asked that. I had a long conversation with one of the execs at a big carrier a couple of weeks ago about that. And he actually, because I was going down that same path as what you were alluding to here. And he actually opened my eyes to something very interesting, and it makes a lot of sense. And in fact, I've read a few pieces since our conversation. They're expecting healthcare spend, depending on how long this goes, they're expecting national healthcare spend to go down. Now, obviously, in the hot spots, it's up. But if you think about it, to get the COVID test, I don't know what it costs, but it's not very expensive to actually have a test. And the folks that are coming back negative and or recouping at home don't have those big expenses that we hear all over the media. So obviously the folks that are in ICU for several weeks, several months, they're obviously are accumulating a lot of money. But most people, and I say this tongue in cheek, so hopefully I don't get any bad responses for you on your feedback. But for the most people, if we look at the numbers, the impact hasn't been that great from a number standpoint on a healthcare perspective. So the healthcare executives are saying all the elective surgeries that people normally go take aren't happening.
That's
Knee
right.
replacements aren't happening. Hip replacements aren't happening. Gallbladder removals aren't. I mean, all those things that people do. And it's funny, I saw a stat yesterday. I think it was either yesterday or today's Tuesday. I'm sorry, it's either yesterday or Sunday. I think it was in the Journal that they said the hospitals are losing $1 billion a day as a collective industry right now because all of the surgeries that they're missing. So again, it kind of puts a different spin. You don't think so because everything you hear in the media is the hospitals are jam-packed and we're spending all this money. When in fact, all the things that we do as American public medically are not happening right now because the hospitals are closed to all those procedures.
Well, and people were slowing themselves down to go to the emergency room. I did think of that the other day. I thought, wow, I mean.
Yeah, I've got a good friend of mine, you know his wife very well, but he's a paramedic for Blue Ash. He said their runs have just been cut by 3/4. He said they're bored. And usually they run all day. He said, unless there's a dire need, nobody's calling the ambulance now.
How interesting.
Yeah. So it's actually the same way. I thought the same thing as you. Oh man, what is this going to do to the health renewals? But they're expecting, I'll never say down in this industry, never ever, but they're expecting them the spend to be a lot lower than it has been the longer this goes.
Well, then we can say that they may pleasantly be surprised.
Yeah.
Or we all may be.
That'd be nice.
Now, you have an office here in Westchester, and most of your setup is cubicles.
Yep.
And, when I mentally go through your office, if someone isn't actually in their own little designated space, they've got these real tall dividers up around them. So when I think about all the social distancing and spacing aspect, I don't really think too much about you having a major issue, but I'm thinking that Peter has probably run into all sorts of questions and been meeting all sorts of people who have some real trials. Peter Ellington, welcome to the show.
Thank you for having me. Glad to be here.
This is going to be really, really fun. I'm really excited about this. This is a beautiful showroom.
Can I interrupt real quick?
Yeah.
I want to give a shameless plug to Peter. It's because of them that we're set up that way, Andy.
Oh my gosh. Well, okay. See how this works.
There's no shame in that.
So Peter, what are you hearing? What seems to be the biggest concern? Is it money? Is it they just don't know what to do? They're hearing too many things about, they've got to meet all this criteria for social spacing and they just don't have space. What are you hearing?
Yeah, I think a lot of it has to do with more of the psychological impact and the comfort of people coming back to work. So we're hearing that. We're hearing how do you create some separation physically to provide some benefit between there. Some places, I think we're a little bit insulated into the point that Jamie made on his office. We're a little bit insulated in Cincinnati than we may be as it relates to maybe coastal cities like in New York or in LA, where the cost of real estate is so prohibitively expensive. They're really jamming people in because the cost of a parking spot, the cost of every square foot of real estate might be 3, 4, 5 times what a square foot of real estate cost here. And so we're a little bit slower than some of the density that we have in our workspaces is not as as dire as it is in some of the coastal large metropolitan areas. But nonetheless, kind of industry-wide over the last 5 to 7 years, the open office has it's been creeping in. About 70% of new offices over the last 5 to 7 years have been more on the open office concept. And there's been a lot of talk about the collaborative benefits of that. Well, now we're running into, and there have been some conversations even prior to COVID with the open office and some of the negatives that come with it in terms of maybe it's a little bit too noisy. How do you create some private space potentially for an HR conversation or a conversation that really does need to be private? So there were some things that were happening that sort of proactively addressed some of the things that I would say we're seeing as a reaction to the COVID workplace as well. But our focus and what we've been talking to about clients is creating sort of that physical separation. How do you do? I mean, furniture is an investment. Your workplace is a massive investment, and cash is tight right now for everybody. So how do you take? Our focus right now is how do you take your existing investment and retrofit it to create both physical barriers that, in my mind, if you create a physical barrier, you're also creating some psychological comfort. And so there's ways to do that, whether it be through a simple reconfiguration. There's ways to do that in terms of maybe putting an add-on barrier or product. I've seen more sneeze guards in the last 3 weeks than I have seen in the last 10 years. But it's how do you make these things in small enhancements to the workplace to get people to feel comfortable to return. And it doesn't benefit anybody to get everybody back in the workplace and they are either worried about their health and wellness, or they're talking about their health and wellness, and they're not doing what is sort of productive economic activity. So what we're seeing is trying to figure out ways with each individual customer, because every customer is different, every office is different, every culture is different. How do you address these within those confines to make the employees feel comfortable, but also have it be an area where they can be productive?
It's interesting. I saw an ad come over, and I think it was from actually one of the chambers, that a display company, and maybe you saw it as well, Jamie, a display company that has those draped dividers for conventions and big spaces to make the cubicles. They were actually advertising them and promoting them as dividers for call centers. So I thought at the time, I thought, wow, we're really, that's creative, because someone could actually make that. That's really kind of where we're at, isn't it, Peter? I saw someone from one of the health departments, and I don't remember which state or agency it was, but they were even telling businesses not to practice the hotel setting anymore, which I can go ahead and say GE promoted that, Google promotes it. That's where everybody just comes in the day, and you just go to your locker, you pick up your stuff, and then you randomly find a place and you sit someplace different every day. And the health department saying, no, we don't want to do that anymore. We want to keep people somewhat contained and controlled. And that's what a complete reversal and a hit to a culture.
Absolutely, and we're as in ways and organizations where that is the cultural norm, and they're backing out of that. One of the things that is probably the first step that somebody can take in addressing that is what type of materials are you putting on that product or that desk that make it cleanable. And there's a lot of cleanable fabrics that are out there. There's a lot of fabrics that, particularly in healthcare, they've got antimicrobial properties. But there's also ones that are just they're bleach cleanable. And so you can have a bleach solution, you can wipe it down. And incorporating, we're seeing that too. How are workplaces incorporating a strategy to, if you have a hoteling station, we have a front desk. We've got a front desk policy that when we've got it's prepared with hand sanitizer, it's got disinfectant wipes, and we've got a written policy when you're leaving the front desk, you wipe down the phone, you wipe down the shared keyboard, you wipe down the arm pads and the mechanism that's on the seat, and you wipe down the surfaces that are there in front of you. And that is really that's really it's important, but it also provides that psychological comfort for the next person that's coming in, saying, hey, this has been cleaned. I can sit here and be here comfortably. But that's something that we wrote down and we incorporated, and that's in addition to the things that everybody's doing in terms of taking temperatures every day and all of that stuff. If I could, I'd like to jump into some things that businesses can do 100% on their own. And this is something that is really just it's something that we've done here, but it's also something they can do on their own. And it's more of, like I said, it's more of a psychological thing, but it's also a physical thing as well. I'm going to hold up a little map over my face here, but this is a map of our showroom. You can see there's arrows throughout. This is our front desk, and everything moves in a clockwise motion as you go farther back. And what we've done is we've created a circulation flow, and everything with the blue and white cross hatching, those are high traffic areas where we're going to run into people if we can't create a one-way street there. But we've essentially created a lot of one-way streets throughout our showroom. They're all done in a clockwise pattern so that they sort of loop back. So to the degree that you can reduce, create a little bit of social distancing just by pattern and circulation. We've done that. And we're seeing offices do that. We're recommending offices do that as well, just to kind of create circulation flow and maintain the recommended social distancing between folks in their office.
That's brilliant. And that's so easy.
It takes time. We were recommending it. We were doing it on our own. We kind of were playing around with it, and we go, hey, what we made we made this traffic pattern, but we got a couple traffic jams. So we had to go through and tweak it a little bit as we went. But we've got a pattern throughout our entire showroom now. And then again, those crosshatch areas, we kind of highlighted those to tell people, hey, these are two-way areas where you have a potential to run into somebody. Just be aware of your surroundings, and be cognizant of those around you.
I love it. Got another one? Come on, give us another one,
Oh,
Peter.
you want another one?
I want another one.
Okay. All right, I'm gonna play around here a little bit, or I'm gonna move this around, and try to give a good visual here. You can see here to my right, this is an open workstation, and again, over on the other side of the whiteboard right there is another workstation. This table used to be where the whiteboard is, and you can see there's some banquette seating there. And it was a sort of a managerial station where you could have a little 4-person meeting around this white table. Well, as a very simple solution we had a mobile whiteboard. We we replaced the table with a mobile whiteboard. It just, if you're, I'll come over and sit down in the chair here, you can see that creates a complete and total barrier to the person that would be on the other side of that. And it creates a barrier. And again, that's just a small piece of comfort for the individual. Again, over here, and I'm sorry, I feel like I'm moving all around. This might get a little
You're fine.
dizzying, but you can see that this is what we call a benching application, and it's in a linear line. So what we can do from a reconfiguration standpoint, and I'm just going to put that down, but I'm going to move while I'm doing it. This desk where I am it slides, it's on glides to slide. So what was previously a linear application now looks more like a pinwheel. And you can see I've created division between these two workstations just by reconfiguring it around and having a 90-degree orientation rather than it being a 180-degree orientation.
You know, I love that. And maybe you're unconsciously doing this, but it's I have to say, it's sad to notice, but you're putting people's backs either back to back or back to face. We can't do the face-to-face stuff anymore like we've been so accustomed to, unless they're well beyond 6 feet, because you don't want anything to, if they're coughing or you don't want it to land on a surface that may be between the two of them and then have them come into contact with that. So yeah, that whole positioning of bodies is very, very important.
It's an orientation issue, and it's just, you know, in some respects, the density is not changing, but the orientation is to just create a little bit of comfort in between people. Sorry, go ahead.
Yes, please, another. You got another?
I do.
Oh,
So this again is this is just a 6-foot table. You know, kind of close quarters, but it used to have two on each side, 2 seats on each side, with the end caps being empty. You can fit 6 people at this table, but just reducing the density of a table. Same thing at this table here. You can see we're just putting 2 desks or 2 seats there. Rather than 4, and just reducing the density. We did that in our break room. We went into our break room and we just took chairs away.
Yeah, I think the viewers have probably heard that a million times. If you've got conference rooms, get those chairs, reduce that number of chairs, and then getting back to signage. Put a post on there, no more than 3 people or no more than 2 people, whatever your room is capable of handling with social distancing. It's just the way we're gonna have to be for a while. Here, can I kind of shift gears here a little bit?
Yeah, this is all you.
This is a thing that I have to acknowledge. You know, when I ended up not being able to go to all my clients in my normal fashion, I stopped wearing my high-heeled shoes. And you know, I didn't necessarily do that at home as much. And then all of a sudden I realized I was sitting in a chair that I maybe touched 2 or 3 times a week. And now I was literally living in it for 10 to 11 hours a day. And I just have to admit, my sciatica went straight through the roof and I was having trouble sleeping. I was a mess. So I called one of your salespeople and said, Danielle, I don't know what to do. And she goes, well, for crying out loud, Pandy, what kind of a chair are you sitting in? And then we started talking and I thought, well, you know what, since I'm up moving around most of the time with my clients, I need a standing, a riser. And my gosh, within days. Now, okay, so I'm wearing my heels around my house, but I'm not sitting as much and I feel so much better. So what other thoughts can we give to these remote workers whose lives have changed just as much? But we've got to worry about their health, because in all truthfulness, and I'm laughing, but I'm not laughing, I could have filed a workers' comp claim due to needing to go to physical therapy or getting some kind of care for my sciatica. We may have the same kind of situations with carpal tunnel, with individuals not being in the proper position for their computers at home because they're using coffee tables, they're using kitchen tables. What advice can we give to those remote workers?
Yeah, I mean, if you're going to buy anything, buy a chair. And that is going to be, I mean, most chairs now have a significant level of adjustments, and there are tips and tricks, and I mean, as crazy as it sounds, there are training manuals on chairs, and I sell chairs for a living, and not all of them are intuitive. So, you know, it's sometimes I feel like I need to call my brother, who's a professional engineer, and say, hey man, you got to help me figure this thing out. But there are significant amounts of adjustments that are really and truly, I mean, they're made so every person's comfortable, and it fits their particular body type, their particular metrics. And, you know, there are things that can be done to make sure that people are sitting properly or ergonomically and in the proper positions throughout the day, and set themselves up so that they can continue to be comfortable. And as it relates to remote work, I mean, every indication is pointing to, if you reduce the density of workplaces and you have the same number of people with the same amount of work that needs to get done, you're going to have to go somewhere. And if the remote workforce becomes more robust, I see companies being a little bit more proactive about their in-home standards programs, and creating standards for their in-home workers. We've gotten several requests on that front, whether it be for ones that are displaced right now because of the current situation, or even in a planning standpoint, and saying, hey, we perceive that we're gonna be flipping some people to the remote environment, and that will be their permanent spot. And so it's bringing a bigger and broader mobility strategy into play, and that conversation into play. And what does that look like? And again, that's different for every company. It's different for every culture. But how do you strategically provide people a place to work where they can do their best work? And that might be at home. It might be in the office. And, you know, I think that really comes down to individual personalities. We've got some high extroverts that thrive and have the most amount of energy and get after it when they're around other people. We've got other people that are on the other end of the scale that really need to have that quiet place. So, you know, just thinking through it, you got a high introvert, make sure they have a place in the office. You got somebody on the other end of the scale, maybe they're a better candidate for an at-home remote workplace, and can be a little bit more productive in that environment.
Jamie, is there anyone like a wellness advisor, or do the carriers have a place where employees can go and look at the possibilities of ergonomics, or maybe this, if I hadn't known where the sciatica issue was with me, where would someone go for that if they're on an insurance plan?
That's a great question, Pandy. One thing that's become very popular with the stay-at-home world we're now living in is telehealth. And telehealth is covered by Corona now, so all health plans have to provide. Now it has to deal with, you know, the Corona itself, or the COVID symptoms, but people can simply do that. As far as the wellness program, some carriers do have those offerings. You know, my recommendation would be to go to an EAP, an employee assistance program. call in there and ask to speak with someone. They usually have health counselors on board or resources that will direct you to the right place to go in times like this where you can't walk, as we mentioned earlier in the conversation, you really can't walk into a hospital right now to have that treated. So there's various resources available, but a true wellness plan, not necessarily. But I would steer you either towards a telehealth visit with a doc or to an employee assistance program. And their main function is to provide those resources for you.
Well, and correct me if I'm wrong, but even somebody on Cobra still can go online to Aetna or Humana and get into their account and find those numbers or find out what kind of coverage they would have on that kind of stuff, right?
Absolutely, yeah. Cobra is an extension of the plan, so you still have all the full benefits of an active employee. You simply have to pay the full, assuming the employer, which 99.9% of employers do, you're paying the full freight of the premiums. So that's really the main difference of Cobra. But yeah, as a Cobra employee, as long as you're up to date with your premium payments, you have full access to what an active employee would have. Absolutely.
Oh, so that goes back to the earlier conversation. If your employer's not paying their premium, you as the employee may not have that service available to you.
That's it depends on how Cobra is set up. That's correct. Some TPAs collect that and pay that on behalf, and some direct Cobra. For example, if some Cobra plans are ran directly through the carrier, that carrier direct bills, so that Cobra premium could be paid up, even though the employer is on furlough for his or her premium.
Yeah.
So yeah, it just depends on how the Cobra is set up and how that employer has chosen to administer Cobra, what service they've chosen, I should say, whether it's direct to the carrier or they have a TPA. But yeah, that could happen. You're absolutely right.
Is there anything that, Peter, is there any one or maybe two or three very important things that employers should be doing, again, as they're going through their workspace and they're again trying to provide the safest and most secure environment for their employees? Do you have one or two, three big tips for them to really look at?
But I would just say create a feedback loop. I mean, at the end of the day, I think you're going to get the most out of your team if you understand what their fears are and in trying to address those appropriately. I mean, it's sometimes that can be daunting, and it, and fear is a funny animal, but creating that feedback loop. I mean, that has nothing to do with my, I guess, expertise in the interior environments area, but I believe that to be true. I think another thing to kind of piggyback on what you had just mentioned, and from an insurance perspective, the Bureau of Workers' Comp for Ohio actually has some ergonomic resources that are available out there. There are some ergonomic grants that are available as well. They need to be dug into on an individual basis. There's some measurement that has to be involved in order to unlock those grants. But they do have quite a few and quite a bit of ergonomic resources, as well as some ergonomists on staff. So that's another avenue in terms of maybe some employee wellness resource. There's some stuff that's available through the BWC of Ohio.
That's really nice. Again, another major advantage of having a state-ran workers' comp program. Jamie, how about you? To wrap it up, what's your advice to employers at this point in the game?
I would say as much as you can, stay the course. I'm a small business owner myself, so I understand the travails and tribulations we're all running through right now. We're slowly bringing folks back on a voluntary basis. So I understand that need as well, because we have some folks that are apprehensive about coming back. Peter made very good points in his presentation about distancing and how do you make those people feel safe, even in the what you call them, the crosswalk space where you can't go one way. It's funny. because we have stairs at our place. So one time you'll see people running up down the stairs one at a time. So, but I would rest easy knowing that the insurance companies are there. They are working with us to especially the smaller businesses, to make sure that they keep plans in place, keep them affordable, take advantage. I mean, this is a great time to take advantage of technology. We're doing a lot of open enrollments right now using electronic platforms. So the communication can still happen. We're doing a lot, as I mentioned earlier, telehealth. A lot of people were always adverse to telehealth. Now we're getting a lot of people that love it and they're forced to use it. But now they've embraced it and really liked it and wonder where it's been for the last 5 years. It's been there the whole time. So, and then the biggest thing I could say is if you can afford your premium, to pay it, because you don't want to put your employees, and again, you and Peter alluded to this today, the employees are on edge. They're not sure which way is up right now. And so the last thing you need to do is, especially since we're in a health crisis, is cut off their health insurance, not intentionally, but, trying to save some money here to do something there. Eventually you're gonna have to pay for it. So my biggest advice is if you can afford it, go ahead and pay the bill now. And then work your way down, especially with PPP money. But that's the biggest shock we've seen right now are those folks that their employer has chosen to delay their premium, and then they call us scared because they think their insurance has been canceled. So you're gonna have to pay the bill one way or the other. So if you can afford it, I'd recommend you go ahead and pay it now. So, but there's lots of good things, Fanny. It's as you mentioned. I mean, this changes every other day. I mean, you and I talking before we came on air today, and there was a new rule that just came down 10 minutes before we got on air. So it's an ever-changing thing, especially if the Congress gets their third phase through that they're working on. I'm sure there'll be additional changes there that will affect this. So, I would say stay patient. If you have questions, contact, your broker, your agent, your carrier, and work with them because we're all in this together.
Absolutely. Let's talk about a couple of those changes here real quick with our viewers so that, again, I want you to be on top of everything that's happening as much as possible. And again, I know that you're getting all this information from a lot of the other sources, but this is stuff that when we talk about it, it's stuff that you really need to look into. And one of them is a change with the PPP on the forgiveness of the loans. They have recently just decided that someone heard that employees don't want to come back and are actually enjoying unemployment and aren't all that interested in going back to work, thinking life's going to go back to normal. And that could jeopardize the forgiveness of that PPP loan for many employers. So and we alluded a little bit to this last week, but now we've got this change that's going to help you out a little bit. So here's what you do. If you have an employee who just flat out says, I'm sorry, I'm not coming back, I'm not interested. If you can prove that you've done everything you can to help that individual understand, look, the hours are here, the work is here, this is your schedule. If they decide that they don't want to come back and you can prove by a letter or a document that you had the job there for them, you will be forgiven. Now, of course, if you can hire somebody into that position right away, that's phenomenal, because again, you're going to just move along forward without a skipping a beat. But if you can't, make sure that you're sending a letter to that individual, making it very known when you're going to reopen the doors, what the individual schedule is going to be, as much information about the position to reflect that it was exactly what they left or what they're coming back to. And I tell my clients, if you're going to do that, you send it certified and you require a signature. You want some kind of a paper trail that they opened it, they saw it, and had to acknowledge it. And then you hang on to that and you attach that with your COVID documents. Remember, we have a COVID cabinet. We've got all of our COVID activities, paperwork, and documents in that section. That's where it goes. And then when you have to turn in all your justification and paperwork for that forgiveness, you have that there if your count's down. So that's a big one. I want you to talk to your bankers about that if you have to, but there's no set other format or document that you have to do with that. If you have any questions, let me know. Another real recent change just today is they have made changes to the flexible spending accounts that many of you have and that you're offering your employees. So I need you to get to your TPAs and talk to them and have them walk you through all the different little changes that are going to be wrapped around that particular account. Remember, flexible spending accounts are the ones that you get to roll over 500 into the following year, but otherwise you lose everything. Well, again, based on everything going on, I think this is under the CARES Act. If not, it's just something that IRS has decided to do, because remember, that's under our Cafeteria 125 plan. And that's how I got the information, was through the IRS. So get with your TPA, talk to the representative and get those details, because that's information you want to pass out to your employees. You don't want them to miss out on the advantages there on that. Another change that happened last week at the end was that they want to stress that there are tax relief programs under the CARES Act, and employers need to research those and take advantage of them as they occur, or as often and as soon as you can. So again, that's under the CARES Act. If you haven't talked to your banker or your CPA, please do that. For those of you who are joining the show for the first time, we are very, very, very firm in emphasizing that you need to surround yourself with very good people. And one is a CPA or your banker. And you make one of each right now, a banker, a really good banker, you best friends, send them flowers, bake them cookies. A CPA that is gonna just shoulder up with you and dig in and not give up. A wonderful HR consultant or a labor law attorney, of course. And then you've got to know your employee's benefit broker, your 401k broker. You've got to stay as close to them as possible, because again, this stuff is changing at the speed of light. Don't let something slip between the cracks. Next week, we're going to have Scott Warwick back, and we're going to be talking about the different little details with the Fair Labor Standard Act and how to make sure that you're absolutely paying your remote workers correctly. And then a surprise person, I'm not going to tell you, but I hope you had fun. And remember, all of our speakers and representatives are open. If you have a concern, if you want some advice, if you just need to talk to somebody about what you're dealing with, that's what they're here for. And as Jamie said, we're all in this together. You might not be his client, but if you have a question about something he said or mentioned, give him a call. I'm going to obviously tell you to come and look at this phenomenal showroom, which Peter and I have showed you glimpses on. They are open, and we'll walk you through any questions you might have about what you saw today, or any questions that you might be experiencing that you didn't see. My name is Candy Pridemore, and I'm the Principal Consultant for the Human Resource USA. We want to thank ICRC-TV again for giving us this opportunity, and we really hope that we'll see you again next week. Oh, and tell your friends, have everybody watch.